So it's been a unique program for more than 20 years.
Over how many days do you give the treatment?
It's 5 treatments. Usually we do it every other day or twice a week for 2.5 weeks.
How many patients have you treated with acoustic neuromas?
1,000. Treated 1,000. It's all outpatient. Patient comes in, gets their treatment, and goes about their business.
That seems like surgery, in my opinion.
Yeah, well, I agree, but sometimes it's hard to relay that feeling to others. I try to tell everyone all the options, and most people come to the obvious conclusion they don't want someone's hands in their head, they don't want surgery, they don't want the devastation of hearing loss, of facial paralysis. So it's a very nice program for acoustic neuromas. There's only a few acoustic neuromas diagnosed, but for those people, the diagnosis can be devastating. There's a new study out. I want to talk a little bit about that. It's from Mayo Clinic. And what they found is that people with heart failure are more likely to be diagnosed with cancer than those without heart failure. So what do you think about that?
Maybe there's something that's causing the heart failure and the cancer. I know a few weeks ago we were talking about vitamins, and sometimes some can cause heart failure and cancer.
Right. I mean, that was one issue. A lot of people, and we have a special program coming up next week with Dr. Paul Offit, the author of Do You Believe in Magic? And I know you read the book and you've read about his role in vaccines. And do you want to just give a synopsis of what happens when people take mega vitamins or antioxidants, which they think are helping them?
Well, a lot of times people think they're taking all these vitamins and minerals and herbs and supplements helping them, but in truth it's causing more harm than good.
What do you mean by that?
There have been studies randomizing patients, to vitamins and not to vitamins, and the patients who got vitamins and minerals were found to have increased rates of cancer, heart disease, atherosclerosis, as compared to the patients who did not receive any supplements.
Right. So it's interesting that the death rates are up to 25% higher in people who take vitamins than those who don't. And it's death from cancer and heart disease. And it's not just little studies. It's studies with tens of thousands of people randomly allocating treatments. And some of the studies were in men who are heavy smokers, randomly allocating them to additives versus none. And you'd think, of course, you had antioxidants or mega vitamins. Everyone would think it's innocuous. But the fact is, it's not. It's dangerous. And why is it these vitamin stores keep on making big profits? Why is that?
Well, they have a very strong lobby.
Why do they have a strong lobby?
They make a lot of money. I think it's a $30 billion a year industry, and they don't have to prove that the vitamins are helping anything. So they don't have to prove that it's helping you stop cancer or ginkgo, get better memory, as opposed to other industries which are more regulated, and you have to prove they have a positive effect with tolerable side effects.
So ginkgo doesn't help your memory?
I believe not.
I forgot where I put my car keys.
That's not good.
Yeah, I better take my ginkgo so I can know where my car keys are.
My favorite part was when Paul Offit said you have two types of medicine that works and medicine that doesn't work.
So what is alternative medicine? All these patients that are going out there and spending oodles of money on alternative medicines, ozone therapy, vitamin C drip, and XYZ, they're costing oodles. What does it do?
It gives the vitamin supplemental stores some money.
Some money? I think he said it's, as you said, $30 billion.
And it's getting more. It's increasing every year.
And why doesn't the government regulate this vitamin industry?
I forgot the name of the law, but I think in 1990, the mid-90s, there was the unofficial name is the snake oil salesman law. Was that?
Okay, and what is that?
They do not have to prove efficiency. They don't have to prove that their vitamins and supplements actually do what they're supposed to do.
Okay, so there's two kinds of medicines out there. There's prescription medicine, so we give a patient a prescription on a prescription form, and they go to the pharmacy and they get it filled, and the FDA regulates it for two things, right?
Yes, it doesn't cause any bad side effects, any harm.
It's for safety.
and that and for purpose. And
its efficacy, right. So
yes.
When you go to your doctor and you have a prescription and you go to a pharmacy, the FDA is regulating that medicine for safety and efficacy. Now, when you go to the corner store, which is a corner store around the corner from us, and it's selling these huge bottles. I mean, if there were chocolates, I'd be so happy. But they're all like vitamin C and D and XYZ. Now, when you go and start taking vitamin C, people say, well, what's the danger to me? What is the danger for someone who's taken vitamin C with cancer?
You don't need to be taking 10,000 units of vitamin C every day.
You need to take any?
If you're eating a well, healthy, balanced diet, that should suffice.
Well, how many Americans need to take vitamins?
Very few.
Very few. I mean, in pregnancy, I think folic acid is one of the indications, right?
Yes.
And there's not too much other than that. So most Americans can go to the closet, and if they flush their vitamins down the toilet, probably, according to this data, they're going to live longer.
And have some more money in the wallet.
And they'll have more money to buy some chocolates.
I hope so.
Now, next, we should say we're broadcasting live. If you have questions, you can call us, 800-321-0710. So we're in the WOR studios in the middle of Manhattan. We're a few blocks away from our office, which is Radiosurgery New York at 38th and Broadway. So the number to the studio is 800-321-0710. 800-321-0710, because Noah and Mike are sitting over there in the studio just sleeping, and we want some calls to wake them up. I don't need the calls, but if you could wake those guys up. Anyway, Mayo Clinic, to get back to this article, they didn't even talk about vitamins. They didn't talk about probably the number one thing that would affect the heart and lung cancer and other cancers. What would that be?
I'm not sure. What is it?
Well, probably it's white, and you put a fire on one end, and you inhale the other end, and you soak in all the toxins, and it goes throughout your body. And studies have shown since the 1960s that it increases your risk of heart disease, of lung cancer. You know what that is?
Cigarette?
It's called cigarette smoking. Yeah, smoking. It probably increases death rates by 20%. Anyway, Mayo Clinic looked at people with heart failure, and there's many with heart failure in America, and they have a higher rate of having cancer. So they looked at 961 people in Olmsted County, which is close to my home in Iowa. Olmsted County is the home of the Mayo Clinic, so a very prestigious medical center in Rochester, Minnesota. And these 961 were then followed between 1979 and 2002. The average age was 75 years, and 54% were women. And at the time, they did not have heart disease, and then those with heart disease were matched to another group of patients. And during the 8 years of follow-up, they found 244 cancer cases. So think about it. You had about 1,000 people, and a quarter of them had cancer diagnosed. And the patients with heart failure had a 68% higher chance of developing cancer than those who didn't have heart failure. And the most common were, you can guess, lung cancer, breast cancer, hematologic malignancies, meaning leukemia, cancers of the male reproductive system, and digestive system. So most of those are all smoking-related. Leukemias, lung cancer, kidney cancer, bladder cancer, mouth cancers, esophageal cancers are all smoking-related. But it's funny, the authors said for cause, well, maybe it's stress from chronic disease that caused adverse effects in these patients. So it's something to think about, how one thing leads to another thing. And I think the underlying message is if you have heart failure, you should get checked out because you have a substantial risk of getting cancer. But better yet would probably be stopping the smoking and getting to be a good weight.
And that's one of the best things you can do, to stop smoking and exercise every day.
I think so. You certainly do that.
I try.
All right, and there's one more study which is interesting because it's very close to home. There's new guidelines for patients with cancer receiving chest radiation that they should be screened for cardiovascular disease every 5 to 10 years. And this comes from the European Association of Cardiovascular Imaging and the European Society of Cardiology. Now, if you remember, the first one to report the relationship between radiation in the chest and heart disease was...
I know you studied about 30 years ago in Boston. Can you tell us about it?
Right. So at that time, it was unknown. Everyone thought low-dose radiation was so-called throwaway radiation, throwaway rads, and you could give radiation to the chest innocuously. And we studied that. I actually studied it. I looked at every man who had radiation for testicular cancer from the inception of the department at was called the Joint Center for Radiation Therapy at Harvard until the year I was there. I followed the men. They were mainly Harvard students because testicular cancer is a disease of young men. And then I spent 1 year searching for all those 150 men because they were all from around the world and tried to find out what happened to the men. And shocking, about 20% of the men had sudden death, coronary artery disease, valvular disease, and half the men had radiation only to the abdominal area where the testicular cancer would spread most likely, and the other half had radiation to the abdominal and the chest prophylactically. In 1972, a study from Princess Margaret said that you did not have to radiate the chest, and so that notice came halfway through the study, and so half the men had radiation chest and abdomen, half had just abdomen, and all of the men, that 20%, was actually in the group that had low-dose radiation to the heart. And
chest and abdomen group.
Chest and abdomen group. So we were the first ones. I was the first ones to report that, and it was shocking to my colleagues because they thought it would destroy the field and make people afraid of radiation. Eventually, I was allowed to publish it and publish that. And actually, that led to us being the first to do stereotactic body radiosurgery. Stereotactic body radiosurgery allows us to focus the beam on the cancer and not hit the heart. So more go ahead.
So you studied how excess radiation can hurt the heart, and you spend your focus getting radiation only to the area where it has to go and not to any other organs.
Right. So you want to hit the cancer. All our advertisements say we hit the cancer. People call me and make jokes at me. They hit the cancer. Well, yeah, you want to hit the cancer because you don't want to hit the heart. So people make jokes. They don't understand that normal radiation can do them in, just like I've been talking here tonight about other things that can do you in. Taking vitamins in excess can do you in. Taking antioxidants can do you in. Taking radiation that's not aimed at the cancer can do you in. So
all these small things you don't think about can do you in.
All these things, and each one is 10%, 20%, 30% increased risk, and they add up with time. Sometimes all the risks, being out of shape, being overweight, smoking, bad diet, it can increase death rates by up to 50, 60%. So finally, the European Society, 30 years after I published my paper at Harvard, finally is saying people should be screened for heart disease and the implications of radiation to the chest before they start the radiation. 30 years. So when people talk about how medicine is and how slow it is, 30 years later. Okay, wow. We have a couple questions on the line. I first want to take Gary from Dix Hill. You're asking about vitamins. Good evening, Gary.
Hi, good evening, sir. How are you?
Fine, thanks. What's your question tonight?
My question is based on some of the information and the questions going through here is regarding vitamins and supplements for the their unsubstantiation of using them. Yet you have the American Journal of Nutrition, you have all these different journals out there based on CoQ10, vitamin D, probiotics, and there's a lot of efforts. I can see that it works.
Excuse me, but most of the organizations that you're talking about are fronts for the drug industry. They're not real medical organizations. And next week, you're going to get a special guest, Dr. Paul Offit. And I urge you to listen to him because he's analyzed hundreds of thousands of patients who have had vitamins or not had vitamins randomly allocated. So you're taking like high-risk men, smokers, and randomly allocating them to either to vitamins or to antioxidants versus nothing. And you will see that the death rate increases by 20% in the group that's getting high-dose vitamins or antioxidants. It's very clear. And these organizations that are often